according to the National MS Society, nearly 1 million people are living with multiple sclerosis in America. And this morning, we're looking at some of the symptoms. Dr. Natalya B. with the Brookwood Baptist Specialty Care Network joins us now to talk about this. Dr. B., good morning.
Good morning.
So I'm going to allow you to tell our viewers how to actually say your last name. I'll just stick with Dr. B, if that's okay.
But it's Belotserkovskaya, but I go by Dr. B because obviously that's a lot easier.
It is, but the way you say it's so pretty. So good morning. So thank you for being here.
Good morning.
All right, this is a very serious issue, multiple sclerosis. Explain what happens to someone when they do get multiple sclerosis.
So multiple sclerosis is an autoimmune disease that affects the central nervous system. So that includes the brain, the spinal cord, and the optic nerves. Multiple sclerosis can present in multiple different ways. Most common presentations include sensory loss, weakness, vision problems, balance problems, but kind of some of maybe the less common presentations include just bowel and bladder dysfunction or vertigo.
Now, I do have a dear friend who has this, and I remember, you know, it was the trouble walking and just a balance, as you mentioned. Is that one of the more common ones?
Yeah, we see that. We see that very often, and there's so many other things that can cause balance problems. So sometimes it just takes people a while to make it, you know, to a neurologist, and even more specifically to an MS specialist.
So we still don't know what causes MS, though, do we?
No, we don't. We know that it's a complex interplay between genetic and environmental factors. We know that up to 70 to 80% of the factors causing MS are environmental, and these include things like low levels of vitamin D, smoking increases your risk, and there's also an association with the EBV or the monovirus.
And so how common is it? As I said, I know someone with it, but how common is it across the board?
So we used to quote this number of 400,000 in the U.S., but just like you said, more recently, we know that it's closer to 1 million. So it's not rare, and you know, there's definitely, I'm sure, lots of people know people living with MS.
So for people who are watching, and I know sometimes if you have a problem, you know, we make the mistake of Googling symptoms, and we just, you know, we're thinking we're discovering things. But there are ways that it presents, is that right, that would be more common?
Yes, particularly any sensory loss or weakness, and again, more commonly in a younger person, because where you don't think it's something like a stroke, or anytime there's weakness or numbness or balance problems. And it's always better, if you have any questions at all, call your doctor, make an appointment with your primary and neurologist. It's always better to get checked out.
And when it is diagnosed, what's the treatment like?
So, I mean, just in the past few years, there have been so many new and great medications out on the market. There's infusions, there's injections, there's pills. So, I mean, now MS can be managed with the patient and his or her doctor, just like any other chronic illness, like high blood pressure and diabetes. So MS never means necessarily the significant disability if we catch it early.
Now, will different people progress differently than others?
Absolutely, yes. There's different kinds of MS, and people progress differently, and it's often kind of hard to tell exactly how an individual person is going to progress.
So final word from you, anyone watching now who has any concern, or maybe they have a loved one who has it, what's your advice to help them?
My advice is, if you have concerns, don't ignore them. Call your primary care doctor, get checked out, because we know that the earlier this is caught, the earlier we start treatment, the better people do.
All right, good advice. Dr. B, thanks so much.
Thank you so much. Have a good day.
All right, you have a good day.